I know it's not always easy being a hospice nurse. There are definitely good days and there are definitely bad days.
Okay, I've tried to make this video like 10 times and I'm trying not to be the nurse that cries on social media. And I want to tell you an example of like how hospice and palliative care nursing can be hard, because I constantly talk about how amazing it is. And there are moments when today, it can be really hard. So I was on call today. I'm off now. But I'm still sitting in my car, like reeling and crying over the day, which is very, very rare. But every once in a while, you get to a patient's house where they clearly need assistance, like right now, right away. But because you're a home care nurse, like you're going to their home, you're not bringing anything with you. A lot of times there's nothing for you to do in the moment. And if the patient doesn't want to go to the hospital as DNR, DNI, there's nothing you can do except for like try to order things as quick as possible and get them to the house as quick as possible. But the quickest you could do would be an hour, 2 hours maybe, to get them. Like for instance, this patient that I saw today needed a hospital bed, needed oxygen, needed morphine yesterday. I walked in. This is where I'm trying not to cry because, hold on. When you walk into a patient's house, they're clearly struggling to breathe. Although you can tell they've been living like that for some reason. Like the family is like, no, this is how they normally look. And like the patient actually can like talk to you barely, but they're like alert. They're not alert, but they're oriented. And being like, do you feel short of breath? And it's like, yes. Do you want help with that? Yes. They were denied oxygen before because their oxygen level was too high, so they couldn't get oxygen in the home. Anyway, I can order all the things, right? But it's still going to take a couple hours. So in the meantime, this person who clearly needs to be intubated, but they don't want to be, which I'm all for. I don't want someone to get intubated if they don't want to be intubated and they want to die a natural death. But if someone wants to die a natural death, I want to have medications there to help them with symptoms like shortness of breath. But sometimes you just can't get it there quick enough. And in the meantime, there is nothing for you to do. You can put their head of bed up. You can do air, do a fan. But like, he had no medication I could crush up and try to give to him. Nothing. And the patient died. And the patient died before we could get him anything. Whole what? And on top of all that, the patient was so gracious during his whole fucking death, which happened like that, because sometimes it does. Meaning, like, he would intermittently, like, wake up and be like, thank you. And the family was so wonderful. And I just feel like this because I don't even like saying this because I'm not trying to scare anybody, but, like, it wasn't the best, He could have had things a lot more controlled, and it makes me even more like this because instead of panicking or everyone freaking out that like that wasn't happening, they were all like gracious as hell to me. And I just feel so bad. I mean, I know there's something I can do. He didn't want to go to the hospital. He didn't want to be intubated. I got medication there as soon as I could, and it wasn't soon enough. And then he died. And it's not like, he was going to die anyway. It's not like he died. He didn't die because I didn't get the things there quick enough. He just was going to die. But I just wish we could have given him oxygen and some morphine to relax him a little bit. And it just wasn't quick enough. And that's all. And it feels awful. And I feel sad. And yeah. So those are hard days. And I'm sure other healthcare workers can relate. And I've been through the same things. And it's just what we go through, and it's just hard sometimes. That's it. And I also feel bad about this too, because like now I'm on the internet crying about it. I don't know. I just seen this. I don't even know if I'm going to post this. It's like, what? I don't need you to feel sorry for me. I just want to show the reality of the situation sometimes.
That was obviously one of the hard days. I can remember that. And I remember specifically wanting to record that because I wanted to show everybody that I know it's not all roses and daisies. Like, I think sometimes I wrap everything up in a pretty little bow, and I want to make sure everyone knows that I know it's not always easy. And I want to use that video for an example because that family, first off, they were so gracious and so loving, and so was that patient. And although he died, in my opinion, not well, they still were very kind and loving and all supportive of him and me, and they were all supportive of each other. So they handled that situation very well. But what I think is important to talk about is how can that situation be avoided? How can we avoid those kind of visits? And the number one thing I can tell you is to prepare. Everyone puts it off, including people with life-limiting illnesses. When I visited that person, he was technically not terminal. He was not going on hospice. He was going on palliative care, which is not necessarily a terminal program. Now, he had many wishes, which was, I didn't want to go to the hospital. I didn't want to be resuscitated, all the things. So he ended up dying at home that day. But generally speaking, don't wait until you are terminal or till a doctor tells you, oh, this is it, you only have a few months left or a few weeks left before you start preparing. Prepare now. Generally speaking, I'm a healthy 41-year-old and I already have things in order. And my sister knows what I want. If something drastic or dramatic or traumatic were to happen to me, she knows what I want. She knows where things are placed, all the things. That's the number one thing. Prepare. How do you prepare? There are many things you can do. One, you can buy my book. Just kidding. Just kidding, but not really. In my book, there's really specific examples of how to prepare for the end of life, because you do need a step-by-step guide. It's not simple, but it's still something we need to do. And if you think about it, we plan for everything in our lives. We plan for baby showers, we plan for moving, we plan for new jobs, we plan for picnics, but we don't plan for something that's important. So the first thing you need to do is have an idea of what you'd want if something were to happen to you. And if you are listening to this and you do have a life-limiting illness, the first thing you need to do is talk to your doctor specifically about what the progression of your disease is going to look like. And as you start progressing, what do you want your life to look like? That is how you need to plan that out. You need to get ahead of the game or ahead of your disease so you can have a plan for how you want your life to unfold as your disease progresses. Get an idea and written out plan of what you would like if X, Y, and Z happened. You can make it legal by getting a witness and getting it notarized, getting your doctor to sign it, or you can just tell your loved ones so they know. The second thing you should get in order are anything financial. Even if you don't think that you have anything financial to get in order, you do. So talk to a lawyer, talk to an estate planner, talk to your neighbor who already did this. You can Google stuff if you don't want to hire a lawyer. I know it can be expensive, but get your financial aspects of you in order. Even if you don't think you have assets, you still need to try to get it in order. This is going to help you and help your loved ones after you die. 3 is get your mortuary plans in order. Do you want to be cremated? Do you want to be buried? Do you not care, but you have money set aside for it? Tell your family and make a plan. Lastly, and this kind of goes along with what I've already been saying, but I really want you to understand your disease. If you have a specific disease that you know you will eventually die from, I want you and your family to really understand it. Really know what to expect. Really know when the end is near, so you guys can all prepare, all talk about it, and all be ready. I feel like this family that I was dealing with in the video that I showed you didn't fully understand. They didn't fully understand that the end was near. And because of that, I feel like he suffered and they suffered. And that doesn't have to be. The more you know, the better you can plan and the better you can live, like I always say, and the more peaceful you will die. In being a hospice nurse and being around this and seeing people sad, and knowing how that must feel, I'm not immune to the sadness and how hard it is to be end of life or to see your loved one who's at the end of life. I feel it too, hence my video. I mean, there's really hard days for me and my patients because it can be really hard for many reasons. It's sad. There's symptoms that go unmanaged for some time, and we eventually hopefully will get them managed, but there's a time period where they're not managed. Truly understanding that death is inevitable needs and should bring us some form of peace, knowing that we are all in the same boat. This is happening whether we like it or not. And because of that, how do we want to plan this? How do we want to learn and understand this so it can be as peaceful as possible?